Self-medication is one of the biggest cancers that's eating our society up. We live in a world where when you walk into everybody's home, there's a form of painkillers laying around which is not being prescribed. You find ibuprofen, you find Motrin, you find paracetamol, you find chloroquine and all sorts of medications that's not being prescribed by doctors. We grew up where our mothers always have these appetite stimulants on standby. They will prescribe their own medications for you just because a child lost appetite without finding out what is causing that. Remember, whatever we go through started from somewhere, and we always need to get to the root of it. And because of that, we end up getting a whole lot of health implications as we grow up. Well, today we're here to talk about the importance of understanding how terrible and how bad self-medication can be to us. This is Health and Life with Dr. Daly. My name is Dr. Ann Sansa Daly. We'll be right back after the break. I'd like to welcome you all back to another edition of Health and Life with Dr. Daly. Today we're going to be talking about the effect of self-medication. And I have here with me today Dr. Thomas Ankama of United Nations Field Hospital and Dr. Lauren Shatete of Supreme Specialist Hospital. You're welcome to the show.
Thank you.
All right. So my first question is going to go to you, Dr. Ankama. So what is self-medication and why do people, it's a pandemic, it's something that happens, it's been happening for years.
Yeah.
Is there a specific reason to why people see the need to self-medicate?
Okay, yeah. Thank you, Dr. Daly. As we would say, self-medication is just the use of drugs to treat self-diagnosed disorders or even symptoms.
Okay.
And in some cases, it can even span from the intermittent or the continual use of a prescribed drug to treat a recurrent illness or a disorder or symptom. But generally, as you mentioned in your introduction, it's a global menace now, especially in our part of the world,
Yes.
where access to healthcare can be a big issue.
Correct.
Yes, so generally the trend of self-medication has seen some sort of an ascendancy, especially in the developing world,
Correct.
as compared to developed world. So on your next question about why would people want to self-medicate, I think generally, as you mentioned in your intro, in our part of the world, access to healthcare is a problem. We don't have a lot of hospitals or healthcare centers or medical centers in various parts of our communities and constituencies. So people tend to, if they have some sort of an issue or a symptom or a disease, the chances of them self-medicating is high. You can also have other factors like some socio-cultural beliefs from our environment. There are some people, some cultures or some societies could be extremely religious, that they even see seeking orthodox care or orthodox medicine as some sort of a limitation or as some sort of a complex. So they would rather listen to friends or even close relatives or old relatives for advice, and they sometimes self-medicate just because of those reasons. Well, there are other factors. Or you can also
I think you did mention that because we don't have a lot of medical facilities all over the place. But I also think I can add this to it, that it's so expensive to actually go to hospitals out here, because it's more like cash and carry than it is over there where you get access to health insurance that easy.
Yeah.
Here we do have health insurance, but I don't think it really works like it's supposed to. So the expenses in visiting hospitals, they'd rather take that paracetamol just to cure what seemed to be a headache than find out what's really causing that. All right, that's going to lead to my next questions, which is, what are the risks of self-medication?
Okay, so self-medication goes a long way to cause a lot of risk, or we say complications. One is what we call the drug overdose, because then it wasn't prescribed by a doctor. So obviously you heard from a friend that, oh, I had this ailment and then I went to the hospital. I was given this medication. You didn't even ask how she took it or he took it, and you just go to the pharmacy, ask for the same medication, and then you take. Probably when you took it, you didn't see any improvement. So then you continue taking the medication. So now you're either overdosing. One, you become dependent on this drug because you keep telling yourself, okay, maybe I need to take more pills. I need to pop in more pills. You keep popping, and then before you realize, it becomes a habit. So then it becomes a dependence. It becomes a drug addiction.
Yes.
That is why we had this craze about tramadol. I'm sure it was because someone took it and it was all over. Friends were advising people, telling people that, okay, you can go for tramadol. It will relieve you of your pain quicker. You'll feel good. You sleep well and all those things. So that is also an effect of the drug self-medication.
Okay.
Also, you can mask severe disease.
Okay.
Let's say you're having a very severe ailment. You haven't been to the hospital, but you keep popping pills or pain medications before you realize you are masking something that is life-threatening.
Correct.
Potentially can lead to death.
Correct.
You have an example of an appendicitis or something of that sort. I'm sure it keeps reminding you of having abdominal pain, but you just keep on popping in pain medication before you realize it has ruptured and it becomes life-threatening. So then self-medicating can also mask severe disease.
Okay.
It can lead to what we call drug interactions. So let's say you're already on a prescribed medication and then you didn't go to the hospital, you have something else or a symptom, you go get another medication. There are some drugs that when you take them together, you can have what we call drug interactions. And you don't know, and this can be potentially life-threatening. Yes, so it can also lead to death. It can lead to death. You don't know, you might take something you're not supposed to take, and then realize you end up in the ER. Before we could intervene, you've lost your life. And also we can talk about making some of these ailments that you already have, or maybe I might not even know that you have this ailment, but you are taking or popping in some medications that can worsen these ailments. Like, for example, ulcer.
Okay.
You know, you have gastritis or you have peptic ulcer.
Correct.
And then you are popping in some pain medications that can worsen these ailments that you have. So these are some of the
there's certain pre-existing situations that most people walk around for years, almost all their lives, without even knowing. We have a lot of genetic disorders in our families that we don't even know. Because my grandmother died of this and my mother didn't suffer it, you assume you don't have it, and then you start taking pills, medications that conflict with what's happening inside. And by the time you know, we realize it's probably too late. Which I think explains a lot of deaths these days, because I see a lot of young people.
Unexplained.
Yes, unexplained death. I mean, somebody got sick. Oh, I have a headache and went to a hospital and never came back home. And we don't know what's really going on. All these factors into that. And when you were talking, something came up. You were talking of, you just walk into a pharmacy and buy something. My question is, do we have any laws or regulations where you cannot walk, like tramadol, for instance? I think it should be prescribed. If it's not, it shouldn't be sold to you over the counter. Do we have any laws that regulate, that see to it that we don't just walk in there and purchase medications that, you know, how does that work?
I think there is a law. We have, there's the pharmaceutical policy. Okay. You know, but the issue has to do with poor regulation of these policies. Okay. You know, and aside, those poor regulation of these policies, there are also other factors like, now pharmacy is more commerce oriented than a practice that is supposed to actually, sort of consolidate or crystallize evidence-based drug practice or medical practice. So these are some of the factors. Like you mentioned, most of these painkillers or opioids or some of these analgesics and even antibiotics, these are highly doctor or health professional prescribed medications, but because of these poor regulatory practices, anyone, based once you have some sort of a symptom or you feel like you have some sort of a disease, could easily have access to these drugs over the counter, which shouldn't be the correct thing. That is not ideal. That is a very wrong practice. So these issues have tremendously contributed to some of these prevalence of self-medication in our part of the world. All
right. Okay, so at what point do you self-medicate? You know, sometimes you wake up with an acute headache, like my head aches, and I have ibuprofen. Why don't I just take one or two to relieve myself of the pain? So I know it's not safe, but this is how I'm feeling right now. At what point can a patient or can a person say, okay, you know, let me just take something before I see a doctor? Is it safe? Is it considered safe at that moment? Well, we have first aid. So what's the big deal if I'm trying to? Yeah. But then again, I, as a medical professional, I know it's not right. But to the layman out there who's watching, trying to learn, at what point can you say, okay, let me just take this before I see a doctor? Is there ever a point where you can do that?
I think there's a point. Let's say you're far away from a hospital, or you can't quickly get to a hospital. Yeah. There's what we call first aid, and a simple Tylenol or paracetamol is what we are allowed to. It's over the counter. You can quickly get in there and then get it. But those other severe or highly analgesics are the ones that we don't want people to go close to. The simple ones like paracetamol, Tylenol is fine. Or let's say a simple antacid, you're having a stomach upset, could help before you get to the hospital. Gotcha. Sometimes we say, even on adverts, you see them say that, oh, if you take this and you're not seeing improvements, see your doctor. So there's a time that, yes, you can get an over-the-counter simple analgesic or a painkiller like paracetamol before you go to the hospital, because maybe you might be far away, or at that point in our setting, you might not have maybe money at that moment. You have to go to the bank before you go to the hospital. You have to get a Momo transaction before you go to the hospital. So then you need some sort of first aid. Yeah. So then you're allowed to take a simple paracetamol, a simple antacid before you go to the hospital.
That's interesting.
But I would also add that, I mean, fine, there could be a middle ground, but generally self-medication is wrong. Correct. That is why we have room for first aid. Yeah, but in some instances, like my colleague mentioned, fine, you have some room to take them, but those are more like small doses, and even they're supposed to be for just a short term. Okay. The main precedent after that is to make sure you still go to your healthcare to see your healthcare professional or your GP, because it's because there is that chance that, I mean, you could take drugs and you can become, of course, maybe acutely you had some relief, but you could become dependent on those drugs, especially people with some mental illness or depression and whatnot, and you could be dependent on it, and that can have a lot of debilitating effect in the aftermath.
So, in this case, does antibiotic fall into that category?
No.
No.
So it's just paracetamol.
Yeah, it's mainly those simple, those basic analgesics like paracetamol, and it's just maybe just a dose, you know, and you have to make sure you still get.
So the last time I came to see a doctor, they tell me this is the symptoms I'm having, and the doctor prescribes let's say any kind of antibiotic for me. And next week I'm feeling that same way. Why do I have to come see a doctor when he's going to tell me the same thing and take money, which I don't have anyway?
So I think this also gives us a chance to also practically delve deeper. Because maybe the first time we came, there was no test done.
Correct.
So you had a tummy upset, we give an antibiotic, because then we have a higher, what we call a clinical suspicion of what we might be thinking was wrong with you. So if you are to come back to tell us, okay, doctor, I took the medication as prescribed for 7 days or for whatever days I was giving, but I'm seeing no improvements, then it gives us an idea, because in our setting, because of our money issues and people not having money, we tend to, as doctors, sometimes pick the kind of labs or investigations to do at a time.
Correct.
So then if you come back and you complain that, oh, the antibiotics couldn't work for me, then it gives an idea of maybe running more tests, maybe to do a stool test, to do a urine test, or do any other test, or properly to examine or take a deeper history from the person before we can then say, go take another medication. Yeah, so it helps.
Yeah, and okay, I would like to also add that antibiotic, I mean, usage or prescription is one of the commonest drug that is sort of prescribed worldwide. So there's that chance, there's that likelihood that people could self-medicate if they have access to these medications. Yes. And generally, antibiotic misuse or self-medication is a major public health threat.
Correct.
Especially in our environment. So under no circumstances should an individual just take antibiotics without the guidance of a healthcare professional. So that is a no-no, especially when it comes to antibiotics, because there's that chance of antimicrobial resistance. Should you take these antibiotics? That means that some infections that probably those medication antibiotics could cure,
it doesn't do it for you.
May not really work next time, and it's a big issue. So that is the main advantage in seeing the doctor.
All right. So before we go on a commercial break, I think we're all learning here. The whole idea of this program is to educate you, so you have a fair idea of what is happening with you, when to walk in to see a doctor. So like they're saying, just because you went and saw a doctor and they prescribe one medication for you for specific symptoms doesn't mean that the next time you're going through that, it is the same thing. The medication is probably masking something bigger than what was seen earlier. This was your first time coming in. This is what we think it was, or this is what we picked on. Doesn't mean that that is it. Yeah. If you keep experiencing the same thing over and over again, you should know better to walk in and see a doctor than repeating the same medication. Then you become dependent on it, and sometimes the medication doesn't even work the way it's supposed to do because you've taken too much of it at a time. We'll go on a commercial break, and when we come back, we'll continue from where we took off. Welcome back to the show. We're still talking about the dangers of self-medicating. And while we took a break, I remembered something. I just wanted to find out from my doctors over here, are there any effects to enema, as we call it? Because I know when we're growing up, anytime you had a tummy upset, your mother would and it worked. So would that also be considered self-medication, or what would that be?
Okay, so the use of enema syringe, or what we in our parlance we say bentia. I mean, I think it's a common practice. I remember growing up as a child, there was actually a common place in our homes and our household.
Yes.
Well, I wouldn't want to. It depends on the content of what is in that syringe, and that is what is being administered into the child. Because fine, there are various forms of medicine. We have traditional medicine, and we have the orthodox or the foreign medicine. Yeah. Of course, some of them may have some of them work. But as I say, it depends on what is in. But of course, parents should always be careful, because sometimes looking at in some instances where you have a very young child, I mean, if that pressure, the force at which the parents probably squeezes the enema, you can have, if that pressure is too much, you can sort of gape or even rupture some rectal tissue in that child, and that can be an issue as well, So in those instances, we have to be a bit careful. And I know generally with the enema, I remember as a child, it was more of things like leaves, what we normally call
and the blend,
and some of them could also have an extremely purgative activity, which can also lead to dehydration and whatnot. So we should be a bit careful with that. Fine, I mean, in our environment, we consider all those factors, because healthcare may not be readily accessible, especially if you are in a rural environment. Fine, there could be some leeway to those things, but generally with our practice, it's not acceptable if it's not done under a certain guidance of a medical personnel. So that is what I have to say.
Even though it works, it's not as safe as we think it is to administer that. I mean, our parents are not doctors, and they've never been to, so they have no idea. All they know is our grandmothers or their mothers' mothers did it. We came to meet it, and it worked. So we're also going to take it from there. But education has actually opened our eyes to a point where some things we don't do anymore. Yes, even though it's very effective to a point, I don't see people doing it that much of it, which is good. It means we're learning, and as you learn, you get to understand how things work with life. With that being said, I think we've actually covered a whole lot today. And I'm hoping that we're all learning from this, because that's the whole purpose of this show. We're here to educate. This is information you hardly get. You have to see a doctor before you get certain information. Like we're talking about self-medication right now. It's a household pandemic. It's something that people don't sit down to talk about. All we do is, oh, yesterday I had a headache, or I took this. And my friend is telling me she's also experiencing headache. Oh, I took this, it worked for me. You two do the same thing. And it's been going on and on and on. And it's actually killing people. If you see the death toll right now on the youth, now it's higher than it's ever been. Now, you wake up every day and you hear somebody 32 years, 27 years, 35. They're too young to die. You've not even lived half of your life. It all this whole thing, it boils down to things that we're taking, we're ingesting, that we're not supposed to take. We're masking a whole lot of diseases. I mean, genetic disorders that we don't even know, because we're taking other medications that are covering it up. So we're not seeing it until it's too late. A lot of people don't even want to see the doctors. They just sit around until they're on the verge of dying before they walk in and say, hey, this is what is happening. And the next day, you hear they're gone. You do not want to find yourself there. Today's show, we're going to end for now. We're going to see you next week. Thank you very much for watching.
Start today, you get out tips with Dr. DALY. Yeah, giving you all the health benefits you need for your better life. Watch this show, Health and Life with Dr. DALY. 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 Health and Life